Well, hello everybody and welcome to ICMDA webinars. I'm Dr. Peter Saunders, the CEO of the International Christian Medical and Dental Association, which brings together over 50,000 doctors and dentists from over 80 countries around the world. So it's my pleasure to introduce Karen Rispin, who's speaking to us today on resources for disability and healthcare mission, a much neglected area of mission, especially given that so many of the people that we deal with are now suffering from various forms of disability. And Jesus's ministry was often to those who were disabled. Karen is the project manager of the Assistive Technology Catalyst Project with Ideas and Bethany Kids. She's passionate about reaching out with true hope by catalyzing links to resources to facilitate wheelchair services and care for those with disabilities at faith-based hospitals. She's a missionary kid who grew up in Kenya. We've just been chatting about that beforehand because I worked there as well, and she's led research teams, published on appropriate assistive technology for low resource areas, and serves on a number of international committees. Her desire is that those with disabilities receive appropriate provision of assisted technology along with medical, social and spiritual care. Now, as I mentioned, we'd normally have Karen live presenting, but the presentation involves some videos and we thought it was best to do it pre-recorded. So we'll be watching her PowerPoint presentation very shortly. But Karen, you're here live on screen, and can I just hand over to you now to say any words of introduction before we show this video, and then we look forward to welcoming you back for the Q&A in about half an hour's time. Thanks.
Sure. Thank you very much for this opportunity. I'm really looking forward to chatting and answering questions at the end. Appreciate very much ICMDA for making this possible, and all the translators. Thank you. Hello, my name is Karen Rispin. I'd like to talk to you about resources for disability in healthcare missions. Thank you so much to ICMDA to make this possible. I am the manager of the Assistive Technology Catalyst Project with Ideas and Bethany Kids. Disability is said to be one of the fastest growing global health needs. The World Health Organization has stated that. And these are some of the reasons that's the case. The population is aging. Many of you are medical people, and some of this is because you're taking good care of people. People are living longer. Some of it is because we've exported our great eating habits from North America and Europe, and diabetes is rampant with all its health problems, such as amputations, blindness, and so on. Fewer children born with disabilities are dying early, so they go on to need assistive technology. Assistive technology is any device that helps you to manage. Chapel Kasnabis with the World Health Organization likes to say, this isn't about other people. If you aren't using assistive technology now, you will be as you get older. For example, I didn't wear glasses as a child. Many of us, as we get older, use hearing aids. We had struggles with mobility. So it's not about other people only, it's about all of us. It's also something that Jesus himself focused on. Many of you would like to heal as Jesus did, and he primarily focused on people we would now say are people who have disabilities or are considered to be disabled. If you look at his medical miracles. In Luke 14, he directly asks us, invite the poor, the crippled, the lame, the blind, and you will be blessed because they cannot repay you, for you will be repaid at the resurrection of the just. This is the one type of medical outreach he directly asks us to do. Here is a short video of Francesca telling her story, and I want to show that now to give context.
My name is Francisca, and I'm born with a spina bifida. We are 8 in our family. I'm second born. Yeah, but they are all okay. They don't have any disability. I grew up in a village, back in a remote place, back in Samburu. It was really a place that nobody don't understand about what disability means. They don't have any information about disability. So they just believe that I'm a curse, you know. In our culture, they just put the poison, you know, some poison, and then they soak, and then they give a child who was born with a disability, so they can kill. So when my mother found that I was to be killed, she ran away with me. I just went to school like a normal child, but it was really hard because the school was far. It's really hard for me to walk. I don't have friends in school. No one understands me. I was really leaking, you know, all wet because I don't have any bladder control. So nobody really wants to sit with me. When I was a teenager, I was fed up because nobody loves me. So I was saying, I think that's better for me to die. I think my grandmother was right. It's better for me to die than to live, because living in this life is as a hell. So I tried to take a poison twice, but I didn't die. One of my uncle came to Bible school, and that time he came and just see about Kijabe, and then meet some doctors. He came and told my dad that there's a hospital. I think we can take Francesca there. I was sitting to wait for Dr. Bransford to come. I didn't know Dr. Bransford, so I just waiting for the doctor to come. I had an infection with my legs, you know, it's really infection and, you know, a lot of pain, you know. So he came and see my leg, and then he saw my back, and I was wondering, now, who told me that I have a problem in my back? Because I didn't tell him. I didn't know what's the problem. What's the problem with my urine, so, you know, my incontinence, or the problem with my leg. I didn't know. So when he came and told me about spina bifida and about my problem with the legs and the, you know, bladder and all, and I was so excited to meet him because he told me the things I didn't know. Dr. Bransford introduced me to another doctor called Dr. Kimberly, and they told me that they're going to teach me how to do CIC, how to empty my bladder. My life changed completely. The first time I used it, I emptied my bladder and I became dry. I see that I can live a normal life. They showed me the love of God because they loved me, they're encouraging me, and I thank God because my dad came to the Lord. My father got saved, came to the Lord, and even my brother, even my sister. When I came to Kijabe, and then I was really transformed. I can be able to empty my bladder, I can be able to be dry, even to walk around. I can be independent, you know, I work and get salary and have the house. At time I say, oh, so I can even date, I can get somebody. So I date my husband, and then I got married. And the first time when he told me that I love you, I was like, what? I say, do you know that I have a disability? I say, yes, I know you have a disability, but I love you the way you are. I'm praying for God to give me children. Yeah. Yeah.
No longer is inappropriate assistive technology the only option. It used to be, some people thought you had to get whatever you could. And it led to things like this. I work with wheelchairs, so I'm using many wheelchair examples. And as you can see, this one wheelchair has caused a decubitus ulcer, a pressure ulcer, which puts that person at risk for infection and death. This other wheelchair is much too big for the little girl in the chair. She has spina bifida, she has a good upper body, but she has very little mobility in this wheelchair because it is much too big for her. And it can cause chronic problems. Sitting cross-legged like this all the time, I know of children who are essentially stuck in that position. Appropriate assistive technology matters, and now it is possible. So how did I get into this? It began with a research focus, and I want to say right now that I'm not a doctor, even though the slide you may have seen advertising this. I think that's because most people are doctors, but I come from a research focus. I was leading the LeTourneau University Wheels project, looking at the function of wheelchairs in low resource settings, and I was doing that in partnership with Bethany Kids. We did that because there was a need for hard data. As companies began to make wheelchairs aimed directly for use in low resource settings, it became necessary to obtain feedback on how they work. Of course, these companies all had limited funding, and their clients had limited funding. In order to use limited funds well, it's good to know if what you're doing works. So I worked with a team of undergraduates. We came and asked these 4 questions and developed outcomes tools that are now validated and available in Spanish and English for these 4 questions. They're available at that website. Is it clinically suitable for the user? Is it broken? Can it be maintained? These 2 were to be answered by people with wheelchair experience, therapists or technicians. Is the wheelchair user satisfied? Which of course is feedback from the user themselves, which is absolutely crucial. And does it roll well where it is used? That also includes objective data. It was a great win-win-win situation. We were having fun. I would go to the wheelchair companies, which were great not-for-profits, and I would say, would you like an independent field study? And they would say, pick me. And I would say, get 30 chairs to Bethany Kids at Joytown, and we'll come see how they do over several years. So these were long-term studies. The research papers published in well-recognized journals are available also at my website. So the wheelchair companies got feedback. Bethany Kids got wheelchairs for the children they served at Joytown. And my students got a cool trip and got published, which helped them get into grad school. Most were pre-med or pre-PT or OT. Because of the research I ended up doing, I was invited to join some of the initiatives. When the World Health Organization declared disability a fast-growing global health need, different grants were offered, and the University of Pittsburgh got one to start the International Society for Wheelchair Professionals. This included expert committees. I was invited to these expert committees, and from there I was invited to World Health Organization and USAID stakeholder meetings, and I began to see the big picture. And I saw that so many things were becoming available, but they weren't connecting to the faith-based organizations that provide much of the functional medical care and the social support and spiritual support in Africa south of the Sahara. They're tied in with the churches that provide one of the most important social support networks in Africa south of the Sahara. This bothered me. I had grown up in Kenya as an MK. I had volunteered at Kijabi Hospital. I knew a little bit about these organizations. So I began to move to a full-time focus. First, I just tried to say, hey, you guys should work together, but it's not that simple with large organizations. So I moved to a full-time focus with the Assistive Technology Catalyst Project, and there's the website if you'd like to look at it. I was able to present at the GREAT consultation, that's the Global Rehabilitation and Assistive Technology Consultation in Geneva, looking for ways forward to improve assistive technology around the world. And as you can see, I presented on the importance of working with faith-based organizations, and it was well received. But this is going to take engagement at many levels. It's not going to just say, yeah, we should do this and it works. So we have to go forward step by step. In this next section, I'm going to be mentioning different resources that I learned about. And I want to say very clearly that I'm a catalyst. I'm not working for any of these organizations. I hope not to misrepresent them, but if I do, please forgive me and go look at their websites, which I will have posted. Some of the people from these organizations have said they're going to attend, so perhaps they can help answer questions in the Q&A at the end. But I'm going to tell you a little bit about some of them. And of course, this is very brief, so I can't tell you much about any of them. The World Health Organization started the GATE initiative, which is regarding assistive technology, and they have a lot of resources available and position statements and guidelines and training and so on. And you can just join this and you get a newsletter that also tells you about granting opportunities and tips on this and that. It's a good, I'm on that newsletter, it's a good initiative. They said in consultation with the International Society of Prosthetics Orthotics and Motivation and also ISWP, that there should be these steps, these 8 steps in the provision of assistive technology. Referral, assessment, prescription, funding and ordering, product preparation, fitting and adjusting, user training, follow-up and maintenance. In many countries, AT providers and those who have grants even are looking for partners who can help them hit all of those 8 steps. And my understanding is that quite often it's the faith-based initiatives, the ones, mission hospitals who have been there 50 or 100 years, who know how to work in country, that could do this, that are doing this for many other medical initiatives. And this, as I said, is a wide open door to make an impact in so many lives, to really change the quality of life for people. But as you can see, to do all of this, you need to have some trained people. There are big initiatives. This is AT Scale, the Global Partnership for Assistive Technology. There's the website. Here's a little more about it. And as you can see, they've got lots of funders involved. In the UK, the GDI Hub is one of their initiatives to do with innovation and developing and getting technology to people. I think Julia might be here to answer questions about that as well. CLASP is another large initiative that was funded from USAID. One of the problems is that if you need assistive technology and it's not made in your country, you basically have to order an entire container of certain one type of assistive technology when you really need many types. And CLASP was an attempt to address that, and you can see a little bit about them there. Please go to their website and find out more. You can become CLASP partners. They have a focus in different countries and a procedure to do so. Bethany Kids in Kenya, where I have been working, has been able to become a CLASP partner because they have trained people on staff and a stable initiative. Here are others. Free Wheelchair Mission has been around for quite a long time. They've provided over 1 million chairs globally. They are focused on wheelchairs for people with good upper body, that are teens and older, basically. They initially had done those plastic chairs with bicycle wheels, but when the focus became on appropriate wheelchair provision, they now provide the Gen 2 and 3 chairs that in my research have shown that they do serve adequately for those with good upper body. I think Don Schoendorfer, the CEO and founder, may be present in this conversation to talk to you, and they have a form that you can use to contact them. They have a wonderful way to get the wheelchairs to you. They get them free to port. Beeline is another initiative, freedom, function, and flexibility. They have a very, very adaptable wheelchair type that can be fitted. Different sizes of it can be fitted to children who need postural support, like children with cerebral palsy or muscular dystrophy, all the way up to more active adults, depending on the size, so you have a lot more options with them. There's their website. I don't know if Mark's here or not. Mobility Worldwide, you may have seen those pet carts that they initiated building them in garages and sending them overseas, and now they are wanting to provide different types of mobility as well. I think Scott Walters, their CEO, may be here as well. There's their website. Participant Assistive Products is another initiative. Kiyoki King and Dave Calver are involved with this one. They have started with a pediatric supportive chair, tilt in space, that is very badly needed because there aren't many options for that. And there's their website. Wheels for Humanity is another organization that provides several different types of chairs. They are the ones who got the CLASP grant, so some of their chairs are available through CLASP. Motivation is a great not-for-profit out of the UK who has some really good rough terrain and active folding chairs, and they also have been very involved in the guidelines for appropriate assistive technology provision and the training initiative. Here's their website. But physical care and a device is only part of the picture. You saw from Francesca's story that her pain that she expressed was physical, but it was more first spiritual and psychosocial pain. This is a slide that Dr. Bob Carter used in a presentation at Treating Pain at CMDE. And as you can see, there are different types of pain. And if the most deeply felt pain is psychosocial and emotional and spiritual. Just providing a device doesn't do a lot to solve the pain. And when there is a culture that feels that those with disabilities are shameful and cursed, as Francesca felt, and that is true in many cultures, it's not just the person who is ashamed and isolated. Often the mom, like Francesca's mom who ran away with her, or the whole extended family, if they stick with that child, is feeling this type of pain and is looking for help. There are resources to address this as well. There's a wonderful secular resource from the London School of Hygiene and Tropical Medicine. Many of you are familiar with this and may have taken extension courses or additional training from them. But they have now got a focus on people with disabilities and assistive technology. And one of their focuses is this Ubuntu program, which initiates parent support groups. It's a parent carer training program. You can see this little guy, I put the picture up here, is basically stuck in that position. He's a very bright little person. He's older now, but when this picture was taken, and he had always just managed, and he got around on his elbows and knees. His parents didn't know what was wrong with him. They didn't know that they should position him and stretch him out. So he ended up more disabled than he needed to be. And when it was time to start school, he was doing pretty good, playing with his friends, getting around. You can't go to school on your elbows and knees. They had to put him in a wheelchair, and he was in great pain. And all of that could have been avoided. We see so many children with cerebral palsy who are simply left because parents don't know what to do, don't know what's wrong with this very strange child they have, or they think the child is strange and perhaps cursed, and they don't know how to keep them healthy. And this is a course that helps them. They also have one for Zika and one for early childhood intervention. And for those of you who work with well baby programs and early childhood problems, that one would be also extremely beneficial. There's their website. As I mentioned, in many countries, the church is key to social inclusion and well-being and spiritual well-being in many of these countries. And yet some of the churches still don't know how to think about those with disabilities. Even in North America, that is difficult for many. And this is a wonderful resource for pastors, because if you help someone with a device, or you do a surgery to release a joint or close a neuroseal, and yet they're rejected in their community, it's still very painful. So why leave people to die isolated and in pain when hope and resources are available? How can one start in a way that's not overwhelming, especially since you're all busy and you all have a limited budget? You might all say, yes, it's a great idea, let's do it, but how? What can you do? One easy way to begin, is this really actually how we began with Bethany Kids too, is to invite experienced therapists to serve as mentors for local therapists. To look for people to come alongside, maybe come once a year, come periodically. And there are many therapists, people who become occupational and physical therapists, have a heart to help. And yet so many never hear of an opportunity to do a therapy-based short-term trip. Advertise for people to come short-term. At the same time, tie it into training for your local team with accredited certificates, such as the World Health Organization Level 1 and 2 training for wheelchair professionals. As leaders, take the World Health Organization stakeholder training, which is just a weekend, to look at the big picture. You can do this not only for the material in the course, but also to join the global community, to become familiar with what's going on. Johnny and Friends has a Great Cause for Life initiative, which brings students and professors from the North American OT and PT schools overseas for internships. And this also could work, the professors and could work to train and mentor local programs, or to include internships for local therapists in part of it. There's the link. Again, I'm not with Johnny and Friends, but I'm sure Kimmy would be happy to interact with you about this. Kimmy Archer is. You can also advertise for an expat OT or PT with deep experience in this field to work full-time with you. There's not that many publicized opportunities for full-time service for OTs and PTs. Many would like to give back. maybe there's someone waiting who would be happy to come and work with you. This is Luke McCulley, who is working in Kenya with Bethany Kids, and he's done wonderful work there with the great local team. Please find out what's happening in your country. In some of these countries, there have been significant initiatives. For example, in Ethiopia, the Cheshire Foundation out of the UK has an initiative for this. And it may be possible to find out who has that kind of initiative in your country and obtain appropriate assistive technology from them or refer them, and then follow up in your community health network. Follow up to see that they're okay. Follow up with your parent carer training program, because they're going to need more than a device, but there may be devices available locally. There are networks. The RESNA, Rehabilitation, Engineering, and Assistive Technology Society of North America, has an international special interest group. To join that international special interest group, you do not need to join RESNA, which is kind of expensive, but there is this international special interest group. They are one of the best groups for simply saying, hey, I have a friend in Chad who needs a hand-powered trike. Does anybody know someone in Chad who could help? They have a global network. There is also people that are part of that global network that are happy to volunteer. There is an African community on assistive technology, ACAT, and there is this type of community in other continents as well. I'm most familiar with Africa. And now that had started by some African therapists just pushing it, but now it's being hosted on the GATE community on the World Health Organization. But they have a great newsletter that goes out periodically talking about what's available. There's the International Society for Wheelchair Professionals. They have wonderful links to resources and training and certification. They also have lists of products available. They have a global network as well, and you can join them for free at wheelchairnetwork.org. The International Society for Prosthetics Orthotics, ISPO, is very stable and has been around for years, but they're really focusing on prosthetics orthotics. They've got training and guidelines and support, but they also are focusing on wheelchairs now. And there's a lot of resources on their website. There's also local chapters. You could find out if there is a chapter in your country. Think of a gradual scale up for staff and space to work. This is the Bethany Kids team. Joab is the administrator, and the other three are a technician, a therapist, and a mentor who is himself has some disabilities to work with each person they encounter. But it was a stepwise process. It wasn't, let's plunge into this, let's do it gradually, thinking it through, making a plan, and moving forward. This really opens doors to transform communities. As I mentioned, the spiritual, psychosocial pain and emotional pain is not limited to the person with disability. When the society feels that someone is cursed or their extended family did something shameful, and that's why they have a family member that is disabled or has some disabilities, the whole extended family is in pain and the whole community has questions, and there can be harshness that is addressed when you reach out. As you can see, when Solomon Ropp at Tenwick Hospital brought this free wheelchair mission chair to this young woman, her whole family was present and impacted. You see this again here. This is Luke McCulley working with Solomon Ropp. They had gone out to do some more complex seating out in the community, and you can see here's one child receiving a chair and another waiting in line who can only be carried by his mother at this point. But you can see all the children are listening. They may have been harsh and made fun, and now they're seeing people care and they're hearing. And Solomon always invites the government officials to come and a local pastor to come so that there is community understanding.
Yeah, hey, I'm Will Copeland, a neurosurgeon here at Tenwick. So today is Monday, it's our big clinic day. And our first two patients so far this morning both will need wheelchairs. One is a 3-month-old little boy who we fixed a myelomeningocele or spina bifida on his back 3 months ago. And of course, as he grows, he'll eventually need a wheelchair. The second one was a 10-year-old boy who has a lesion in his spine causing him to be paraplegic. So these wheelchairs are so important to our patients, and we're grateful for any assistance we can have.
What do you think will happen if they don't get a wheelchair?
It's difficult to say, but often it can be a death sentence here in Kenya. The children can develop problems with their skin, and they get ulcers and breakdown from that, which can lead to infection and again ultimately even death.
There are conferences to attend. Johnny and Friends does the Global Access Conference. It was online this last year, and the focus was churches this past year. Mobility Worldwide is initiating a mobility device provision and distribution conference, and they've invited many of the players to come, including some of the big secular organizations like John Perlman from University of Pittsburgh, I believe, is planning to be there, as well as many other organizations. I'd be happy to consult to facilitate what you do. I may be able to help you find out what's going on in country or help you find short-term volunteers or whatever I might be able to visit, depending on what is needed. I'm just trying to go forward step by step to figure out what's the next best thing to do with COVID. Things are very uncertain.
Well, that's the end of the video. Thanks very much. And we're now moving into the Q&A time. So if Karen would like to join me here. We've been listening to Karen Rispin speaking about resources for disability and healthcare mission. And if you're anything like me, you will have been absolutely blown away by just learning about all the extraordinary resources that are available and the partnerships that are going on and how many groups are involved in it. And I can see some of the questions have been answered already online, but they won't have been put verbally. And so I want to come back to you with some of those. From Janice Ho, first of all, can we have practical suggestions on how to serve in missions in these COVID pandemic times, particularly with regard to disability and the kind of things you've been talking about? Thanks.
Yes, there is a lot of information on how to work with people with disabilities during COVID, and some of the large secular initiatives like the International Society for Wheelchair Professionals and others have guidelines up. The London School of Hygiene and Tropical Medicine has guidelines up of how to safely interact and treat and be with those with disabilities. And there is guidelines for people with disabilities they've shared with each other. As far as reaching out in a way that helps bring people to spiritual well-being as well, there's information on the Johnny and Friends website. I don't know if they have any particular COVID guidelines. I know they've had some neat initiatives happen during COVID, and I believe Kimmy Archer from Johnny and Friends is here as well. So yes, there are guidelines in both areas.
Now
and Luke McCauley is also here from the Bethany Kids Initiative, and they've done some really neat things in Kenya during COVID with their outreach. They've made videos for people to look at and all kinds of other ways to try to keep on going during COVID.
Thanks. And Luke, if you're listening and haven't already done so, please do put your contact details into the chat so that people can come back to you on that. Now, you've spoken a lot, Karen, about pediatric resources, and no one will ever forget the picture of that little child sitting in a huge adult wheelchair and how inappropriate that was. But are there any particular organizations or resources you recommend for pediatric disability? I saw the stat 50 million children with disability in the developing world. Any specific organizations who have real expertise in this area?
A real wonderful low-hanging fruit, as it were, something that's easy to do something about more quickly is the London School of Hygiene and Tropical Medicine. Many of you may be familiar with that grand old place, has a big focus on disability now. And one of their initiatives are called parent care training programs that help parents understand that their child is not cursed or a curse, and starts a parent support group in the process of teaching how to deal with a child with cerebral palsy or a Zika or any early intervention. And there's also Beeline, who has a really adaptable wheelchair that if you have trained people in place, can be fit to children of many different needs, participant life, class. There are pediatric chairs available, but really you need to look for a pediatric OT or PT who can come and volunteer and start working with your local PTs and OTs. Look for any courses your country may have for PTs and OTs in pediatric care, and get somebody on that's working with you that's trained to appropriately care for these kids. And I believe Johnny and Friends has stuff aimed directly at children as well, as far as spiritual well-being.
The first video you showed the story of Francesca, which was incredibly inspiring, the little girl with spina bifida who had urinary incontinence and was taught catheterization, which absolutely changed her life. A question here from Dr. Jennifer Alice, who is a family practitioner in Wales in the UK, just saying, wanting to know more about what resources and training might be available in self-catheterization. So I think she's asking from a developed world context, but particularly the developing world. Are there groups which deal with these sorts of issues that you particularly recommend?
The one I'm aware of is the International Federation for Spina Bifida, a European organization that has a global presence, and I believe they have a big initiative in this area. I believe Luke McCauley would know about that since they've been working with them in Kenya. They've been able to supply training and materials, I believe, to enable the team at the medical team to teach intermittent clean catheterization and provide what's needed. So I don't know, obviously, what's going on in the UK or anything, but it would be worthwhile to contact IF, I believe.
Thank you. Now, we've got a question from Winston Chin in Nepal here, which we know is one of the world's most mountainous countries. And I think people listening to your presentation about wheelchairs, Karen, may have been saying, well, this is great, but in our situation where we don't have concrete paths, or we have mountains, or there's lots of mud and so on, are there particular resources or organizations that would be helpful in those, areas where mobility is difficult, even for the able-bodied?
There's been a lot of thought put into that, and different organizations have tried different types of wheelchairs. A three-wheel wheelchair with a long wheelbase is easier to push on rough terrain and motivation. And the UK has a rough terrain chair. There are hang crank wheelchairs for those with very strong upper bodies if it's not too steep. And Mobility Worldwide and Motivation both have hang crank. There's just no super easy solution. In Kenya, quite often children with disabilities are sent to a special school where they do board, and there are better paths in between the dorms and the rooms and adapted bathrooms and so on. There's not an easy answer, but certainly we can provide appropriate seating, at least in the home, and support and a nighttime positioning so that people are much less disabled and are a part of the family. How it goes from there, it really depends on the location. There are some people who've made special donkey seats because donkeys go up and down hills quite well. But then there's the problem of feeling like maybe you're a pack instead of a person, you know what I'm saying? So it's a difficult question. And it's interesting to look at the wheelchairs and mobility that have been provided for hiking in the first world. Some of those type of solutions might be reverse engineered and adaptable there. But part of the problem is just the plain old energy it takes to get up and down that hill, and it's exhausting, and how to deal with that.
You talked about the difficulties in lack of education amongst churches and parents as well, just people just not knowing what conditions are or what's available, or thinking that this is a curse that can't be rectified. From your experience, how do we encourage local churches in the developing world, especially in Africa, to access resources and to be aware of what's available? Can you tell us perhaps about some initiatives you know that have worked?
Yeah, one of the things to do is simply present it at a pastor's conference or have it there in the Bible schools. Johnny and Friends has worked for years to encourage churches, even in North America, to engage with people with special needs. And they have developed some wonderful initiatives and videos, training programs, and so on. And they are now in the process, I believe, of translating them to different languages and doing some traveling to do that. And Kimmy Archer is on the chat, so I'm pretty sure she shared some of her information. It's real important that this be tied in, because these are chronic conditions very often. And as you saw in Francesca's video, her first felt pain wasn't physical. She never even mentioned she had a below-knee amputation. It was spiritual. And when she had that pain dealt with, she was so glad, and now that's what she does. She's a chaplain with Bethany Kids. So this is not only about dealing with, the poor people with disabilities. It's opening ministry doors for them, because it's amazing what God does. Tim Tusink here is on the call too, and he had a brother with severe disabilities who just shone for God, who died recently. And so to enable these people to be an active part of God's church is so important, because without them, we are crippled.
Thank you, Karen. Thank you for mentioning Tim Tusink's brother Terry as well, who just died recently. And if you want to read his absolutely inspiring testimony, we posted it on the ICMDA blog this week, written up by Tim. So you can access that via our website. And it's a wonderful story of God moving in a young man's life and using him to be such an encouragement to others. This is a question that's come via email, and I'm sure it's one that many are asking. The person says, I'm currently working as a physio in a new children's disability program in southwest Uganda, but I've also worked in Bangladesh and other countries. Does anyone know of simple designs and step-by-step instructions for chairs, standing frames, walkers that could be given to local carpenters and metal workers to help them make simple pieces of equipment locally? I often spend long hours trying to get local craftsmen to understand what I want, even with photos, but a step-by-step guide might be really helpful. Any ideas gratefully received. And a lot of the organizations you've talked about, of course, have been Western based, doing great work, but perhaps you could answer that question and talk a bit about what you know about local initiatives for producing prostheses or wheelchairs, and how people might learn more about that, Karen.
There's a neat little book called Village Children that's been out for years that basically talks about patterns for things like that. But there's also, the world is small. So these initiatives I'm talking about sometimes are based in first world countries, but they're really aimed at the rest of the world. And the World Health Organization's GATE initiative has a chat of people posting designs and so on for things like this. Out of London, AT 2030 also provides help with that kind of thing to help people. And the RESNA has an international special interest group, and I think Eleni is here and could share her information of people who, you can join it without joining RESNA, who share information. So you can say, hey, does anybody have a plan for a walker I can build at a local, by a local, in Kenya it would be a fundia, a local person who builds things. So there is a lot of interaction. I know there is starting to be on GATE, I think there is a sort of library of things like that. Of course, vetting it and make sure it actually works appropriately medically is slightly different as well. And sometimes it's better to tie into a validated pattern to use. But I believe, yes, those, especially GATE and the Resonant International SIG, might be really good networks.
Thank you. Question from Janice Ho here. How has the COVID pandemic changed your ministry over the last 12 months? What is practically different about it? What can and can't you do? And how have you adapted? That's a big question in itself.
I think the Zoom is a lot of what happens. I find that it's so much better. For example, if I was going to go to Soto Hospital and talk to the people there about what they're doing and how to get started, and I will go and consult is what I would do, and sit down and plan and work with people that can help do business planning and think about what grants could be written and whether you even want to write a grant, that kind of thing, just to sit with people in person. So multiple trips have been canceled, but I've been looking at a lot of little faces on my screen like this, and ICMDA happened because of COVID. So this is wonderful. So this is a change from COVID that's wonderful.
Yes, I guess we wouldn't be sitting here today having this webinar if it was not for COVID, and it's been a great opportunity for us to give a platform to people like you with so much to say and get the word out much more widely perhaps than it would have been. I was impressed by the comments you were making about partnerships between secular and Christian organizations. And I wonder if you could just unpack a little bit about your experience of, firstly, partnerships with secular organizations working with faith-based organizations, and then secondly, issues around funding. How difficult is it to get funding for these kind of projects, and where do you, what sort of places do you look for it?
First, I'd like to say that a lesson I learned very thoroughly as an academic person: never, ever write a grant for something you don't intend to do anyway. And don't only depend on grant money, because it goes away and it comes with strings. So go forward with multiple ways of thinking of doing something. And if you're beginning to have trained people in place and go forward, sometimes then you're in a very good position to become partners with different organizations who are looking for good local partners. And that's been the case with Bethany Kids. They've been able to be a part of several research projects with AT 2030 and gotten more training from their staff, their class partners, their free, and also there's wonderful Christian organizations like Free Wheelchair Mission. And I believe I sent a document if people are interested in partnering with Free Wheelchair Mission that talks about how to sort of sign up. And I believe that someone's here from Free Wheelchair Mission as well. So they have a wonderful Getting It Free to Port. So in a sense, it's similar. You're going to need to be able, especially with the secular organizations, to fill out a lot of paperwork and know how to write to them so that you know what their priorities are, what they need to know. But it's crazy not to partner. The International Society for Prosthetic Orthotics, know who's in your country with them and the resources they have. ISWP, look and see what they have available and tie into it. And once you're starting to obtain training and join the community, you'll hear about granting opportunities and how they might tie into you. As I say, Luke McCulley is here from Bethany Kids, and I think there might be others who can speak to how that's worked. But again, I would like to say, don't just think of it as trying to get grant money, because unless you're going to do it anyway, that's a burden. It's a burden. If you are going to do it anyway and you can partner well with them, go for it. There is going to be a lot of funding out there. Some of it's going to be coming through governments. Your government of your country may have some funding available to pay for assistive technology if you hit their milestones and join the community. Did I answer the question?
Yeah, no, very, very helpful. Thank you. Now, people listening on this call will be aware of the many needs there are amongst end users in remote situations in the developing world, in hospitals and clinics and so on. You've opened up a window for us to show us what resources are available. it seems that there's quite a big job to be done in connecting resource providers with end users. Could you comment on initiatives there and the way ahead? Because it seems to me there's a huge amount of help out there available that people might not be aware of.
One of the big problems all of these big funding initiatives have, and they speak about, is how do we connect meaningfully with the people who need this? You have to have someone in place who is a stable clinic, a stable community, who knows how to work in country, knows how to hire a team, knows how to pay a team, knows how to hit high standards for medical standards and standards of excellence. And so that's why I've been saying all along that these mission hospitals are that initiative, and yet they have largely ignored, in many cases, the population that Jesus himself reached out to. And now there's resources becoming available, and if we can have trained people in place, hire some local OTs and PTs, and begin to work with expat mentors to come up to the standard of excellence, to have the World Health training, then they will be, when I was speaking at the GREAT initiative, Global Rehabilitation and Assistive Technology Consultation, they're very interested in functional partners. They have to look for them. It's not like they're out there everywhere, but they need to be ready to engage professionally with the milestones, being able to hit those 8 points I put up earlier of appropriate AT provision and care for those with disabilities. So I think it's beginning, just start. It's hard to get going. If you think, oh, we're going to have this and this and this, and oh, it's big. But if you just begin, invite an expat OT or PT to come in for a couple of weeks and work with your therapist, or look for a local therapist to hire, which isn't wildly expensive, and just begin. We've seen what that can do at Tenwick Hospital, and at Soto Hospital, and at Bethany Kids, and other places. None of them started big. Just start, and God opens amazing doors.
Just, we've almost run out of time. Just one final question. Further to your point about bringing healthcare professionals with disabilities into teams working in the developing world, and you talked about opportunities there. How do you go about supporting them, both practically and also psychologically and spiritually?
Well, a good place to start is actually CMDA. They have a program where I believe if one of the docs or one of their people requests training of some kind, they will help, I believe, put together a team. I can also be a resource for that. And then you plan, many of the mission hospitals have had a pattern of having visiting docs. If you were working in Kenya for a bit at Kijabi and Kapsawar, I'm sure you saw that happening. And they have a way of bringing in and keeping people, and prayer times in the evenings, and making sure you're really working with people and not at people. You listen before you do anything. There are resources for doing that meaningfully, to look at, and there are networks of OTs and PTs. Again, the ResNet International Special Interest Group is a great place to look for people that might like to come. Even just look in your local churches in North America. People that are therapists want to give back. And start with just bringing somebody in for 2 weeks, somebody in for a week, look and see what can be done next. I would again say, start small, go step by step, and see how doors open. Johnny and Friends also has the Cause for Life, which is an internship program for OTs and PTs from the US, from different schools, that may tie in well to visiting people with skills, coming and adding training to your team.
Thank you so much, Karen. It's been a real pleasure having you here today, and opening our eyes up to a whole new world, really, of resources and opportunities through your work. So we've been listening to Karen Rispin speaking on resources for disability in healthcare mission. Just remains to me to say thank you very much for coming today, for contributing with your questions, with your comments, with your presence, and may God bless you. Thank you.